Hello, how are you?
Hey, hey, can you hear me?
I can.
Okay, I told you I wasn't missing this one.
You did. Well, I'm waiting on Lawrence and we're getting the kids settled. I'll be right back,
Okay,
okay?
not a problem. Not a problem.
Mm-hmm.
Thanks.
Okay, we're gonna get started here. And let's see. Gonna go ahead and get this screen shared. Okay, can you see?
I can.
Wonderful. So tonight we're going over Medicare Advantage plans. Okay, so when you have a Medicare Advantage plan, there's sometimes called Part C or MA plans. This is your all-in-one alternative to original Medicare. And from yesterday, we taught that original Medicare is just Part A and B. Part A is your hospital and B is your medical. So Medicare Advantage plan is offered by private insurance companies and they are approved by CMS. So they have they only operate because the government give them permission. Okay.
And CMS is the government, right?
Correct.
Okay.
It's on Facebook. Okay. And many times you'll need your healthcare provider who participates in your plan network or your service area to get your lowest costs or for your plan. Now these plans, all of them set a limit on what you'll have to pay out of pocket for the year. And this out of pocket changes year from year. So that's how much you can see whether or not a plan is going to, that's one way to tell if a plan is going to be good for you. How much are you going to have to pay out of pocket, you know, for the year for yourself, for your medicine and things like that. Also, remember that with your Medicare Advantage plan, the in order to get this Medicare plan, it will only have to cover your Medicare's covered services. So you will still need to keep your red, white, and blue Medicare card if you ever want to go back to original Medicare, and that's what you'll use for that card. Okay.
Okay.
Okay. Now, how do you join a Medicare Advantage plan? You can either contact your local trusted licensed agent, or you can visit Medicare.gov. When you join a Medicare Advantage plan, you'll have these things to remember. You'll need your Medicare ID number, the date that you first joined Medicare Part A and B, and both of this information is found on your Medicare red, white, and blue card. Now, very important, Medicare plans or their representative are not allowed to call you to enroll you into a plan unless you specifically ask to be called. Also, plans should never ask for your financial information, including credit cards or bank account numbers over the telephone. This happens every year. Every year you hear about scams, but some things, don't want to have to say again, but you do. These are trickier every moment. So one of the best things you can do is keep your money in your pocket. Is never give out your financial information over the phone. And if you see an agent and they start talking to you about insurance and really trying to get you to sell something to you, and you haven't assigned a SOA, a scope of appointment to talk to them, they're doing something illegal. So it's always important to know what they can't do so that you'll know which con they're trying to give you for that day. If you run into any of the Medicare scams that's going on during this time, please report them to 1-800-Medicare.
Okay.
Okay, covered services in your Medicare Advantage plan. Now, most Medicare Advantage plan offer covered services things that original Medicare does not cover, such as vision, hearing, dental, fitness programs like silver sneakers in the gym.
Mm-hmm.
Also, they cover more things that Medicare will not cover, such as transportation to the doctors, over the counter drugs, and services that promote your health and wellness.
Okay.
Okay. Medicare plans is a fixed amount that they will pay each month. The company is offering for your Medicare Advantage plans. These companies must follow the rules that are set by Medicare.
Mm-hmm.
Okay. Each Medicare Advantage plan can charge different out-of-pocket amounts costs. So they differ from rules and they differ from plans. Whether you need a referral to see a specialist who just go, or you need to have a PCP identified, all of that matters for your Medicare Advantage plan. So it's very important to see, like I was telling you earlier, look at your SOB, summary of benefits, and it's going
Mm-hmm.
to tell what you currently get, and your ANOC, annual notice of change, will tell you what is going to change in your plan. And so
Mm-hmm.
that's very important to compare those things, see what you're losing, see what you're gaining.
Okay. I got
Uh,
to find that because I'm not sure. I'm not sure, but like I said, I had called and because I was trying to find out if I had the one I was asking about, the over the
mhm.
counter,
Mhm.
and she told me nothing had changed on there except I don't have that.
Mm. Okay, and that's important. So when you are ready, look at quotes. What we'll do, or what you could do, is we'll look at the summary of benefits in each of those packets, and it's going to tell you whether or not that specific, like a Medicare Advantage plan, has
Mhm.
a amount of over the counter that
Okay.
you can pay. And then some plans have it where you can pay for more than just the drugs for over the counter. So that's very important, because some of the people use that money that they can get
Get
for
the
that.
glasses.
Yes, they do the glasses.
Hmm.
Some people do wheelchairs. So that's very important. Any medical equipment you may need, you could possibly get it from that particular portion of your over the counter. So not just for medicine.
Right. Okay.
Okay.
Hmm.
Now, whether your plan charges a monthly premium, many Medicare plans have a $0 premium. If you enroll into this plan, you will not be charged a premium, but you will have to pay your Part B premium. So that's very important. I don't want anybody to lose their coverage because, okay, well, I don't have to pay anything. Well, no, you still have
Right.
to pay your Part
Right.
B. So,
Right.
just keep it in line. And some plans pay all or part of your Part B premium. Well, that used to happen. They stopped that in 2000 January 1st of this year. So if you were eligible for Medicare from 2019 on back, you can get
Hmm.
one of the plans. I think it's a plan, one of the plans that will cover for your Part B premium. But anybody who just turned 65 from January 1st on up, they
Hmm.
can't get that plan. So that's one of the things that it changes every year. So it's very important to not only, do your homework, but know, okay, what can I get this plan or not? And if you were to get a plan that did cover some of your premium, that's a blessing, because again, a lot of people are not doing that anymore. They're phasing those plans out.
Okay.
Okay. What you pay in a Medicare Advantage plan? The plan yearly amount of your out of pocket, again, it changes, and each year plans set the amount that they charge for the premium, deductible, and service. The plans, rather than Medicare, decides how much you will pay for your covered service. Uh, what you pay, the plan may change once a year, or it always changes on January 1st. So they try to get the annual notice of change out in September,
Okay.
so you have all that time to go over and see how your plan is changing, and Medicare made that a requirement. Now I'm going to
Okay.
let Lawrence go over the drug portion.
Okay.
All right. Good evening, Sister K.
Hey there, brother Lawrence.
How you
How you
doing,
doing?
man? I'm doing good. How are you?
I'm doing good. I'm trying to get my understanding here.
Okay.
Understanding is the best thing in the world. So.
That sure is that. Sure is that. All right, we're gonna jump right into drug coverage in your Medicare Advantage plan. So most Medicare Advantage plans include prescription drug coverage or Part D. You can join a separate Medicare prescription drug plan with certain types of plans that you'll be disenrolled from your Medicare Advantage plan and return to original Medicare. Yeah, oh, I think that skipped. That sounded weird. Okay, so it's letting you know that you'll be disenrolled from your Medicare Advantage plan and return to original Medicare if both of these apply. You're in a Medicare Advantage HMO or PPO, or you join a separate Medicare prescription drug plan.
Okay.
All right.
I- I'm in the Medicare H HMO.
Okay. How long have you had an HMO plan?
Well, I'm in the Cigna Advantage plan. Cigna, what they call it?
Health Spring?
Yeah,
Yeah,
yeah.
yeah, yeah.
Mhm.
We
Mhm.
contracted with Cigna too.
Mhm.
Okay. So we're going to go over how to get prescription drug coverage. Medicare drug coverage helps pay your prescription drugs you need. Even if you don't take prescription drugs now, you should consider getting Medicare drug coverage. Medicare
Mhm.
drug coverage if you don't currently have drug coverage.
Mm-hmm.
If you decide not to get it when you're first eligible and you don't have other creditable prescription drug coverage, like drug coverage from an employer or union, or you get extra help, you will likely pay a late enrollment penalty if you join a plan later.
Question.
Okay.
Now that's something that I ended up with, and I can't understand why I can't escape from that because of a late enrollment.
Tell her how many
And
years.
now I got to continue to pay that penalty.
For as long as you have
Twice as long as that you
twice as long as you have so as long as you have Part D, you will always pay that late enrollment penalty. It's set up to penalize you if you
Well,
don't
why
have.
is that?
That's just the way the government had it set up. I mean, and they're thinking Medicare is here to help you. So if you have creditable coverage, then you could keep that coverage because your coverage from an employer is always better than Medicare. But if you don't
Mm-hmm.
have creditable coverage, then this insurance is specifically for you. And so they want you to get it. And so they place those penalties in place just to force you or persuade you to sign up for Part D insurance.
Mm.
One more thing, Minister K.
Okay.
Late enrollment penalty, you will only have it for as twice as long as you could have had it. So let's say you went 6 months without getting it. That means you will have your late enrollment penalty for a year.
Well, I don't remember. I think it may have been about 6 months to a year, because when I retired, I think it was in mm, uh I know it's been about 4 or 5 years ago, about 4 years.
Yeah,
And when I left, of course, I had already signed up for my Medicare. I think it was on my 66th birthday. And so I mean, I just didn't never understand. And then when they told me that, they asked me, did I uh did I already have that uh prescription? I said no. And so then all of a sudden I found out I'm having to pay this penalty. And I'm trying to figure out what, and I said, well, how long does that last? And then they tell me I've got to pay that forever.
Mm. Yes, ma'am. Now, the only how you can get around that is if you can prove that you had some type of credible coverage. Now, I know the Church Health Center over there on, is that Poplar or Peabody?
Uh-huh.
Yeah.
That is a credible coverage place because you get
Okay.
doctors and medication there. So if you like had it somewhere like that where you was still getting your medication from, if you can prove
Mhm.
that you didn't break service for more than 63 days consecutive, then you will be able to get that late enrollment penalty come up off of you. But then you'll have to prove that through Social Security.
Mm, okay. And that's not nice. That's just that's
Mhm.
and that's for every month. They have to take that out. I I just don't get it. I mean, penalty should be a certain period, and then then it's done. You get
Mhm.
done with that.
Right.
Yes, ma'am. And
Hmm.
but you know, one of the issues is, and it's the biggest issue, we have our senators writing this information for this Medicare, and they don't have to pay. So why would you have one of some of the richest people in the world
Right.
over your Medicare?
Mm-hmm.
So it's very important. Hmm.
Because I'm just wondering, do I need to go after some of them about it? Because I will. You know, I'm one of them kind, honey. I come for you about that because it just don't make sense to me. But anyway, we'll get back to that.
All right. So this is two ways to get Medicare drug coverage. So the first way is through your Medicare drug plans. These plans add drug coverage to original Medicare. Some Medicare cost plans, some private fee for service plans, and medical savings account plans. You must have Medicare Part A hospital insurance and or Medicare Part B medical insurance to join a separate Medicare drug plan. Uh,
Mm-hmm.
Medicare Advantage Plan, Part C, or other Medicare health plan with drug coverage. You get all of your Part A, Part B and drug coverage through these plans. Remember, you must have a Part A and Part B to join a Medicare Advantage plan, and not
Mm,
all of these plans offer drug coverage.
okay.
All right.
And I do, yeah. Okay.
And then
Mm-hmm.
joining a Medicare drug plan may affect your Medicare Advantage plan. So if you join a Medicare Advantage plan, you will usually get drug coverage through that plan. In certain
Right.
types of plans that can't offer drug coverage, like medical savings account plans, or choose not to offer drug coverage, like certain private fee-for-service plans, you can join a separate Medicare drug plan.
Right. Right.
All right, and these are some of the drug plans that affect your Medicare Advantage plan. The private fee for service plan, which is original Medicare, the
Mm-hmm.
medical savings account plan, the cost plan, certain employer sponsored medical health plans, and you should talk to your current plan if you have questions about what will happen to your current health plan.
Okay.
And then these are special needs plans. Special needs plans are types of Medicare Advantage plans like an HMO or PPO. But these Medicare SNPs plans or special need plans, they limit their membership to people with specific diseases or characteristics. So
Mm-hmm.
Medicare SNPs tailor their benefits, provider choices, and drug formularies to best meet the specific needs of groups that they serve. Uh,
Mm-hmm.
and generally, you must get your care and services from doctors or hospitals in the Medicare SNP network, except when you're having an emergency or urgent care, like care you get from a sudden illness or injury that needs medical care right away. If you have end stage renal disease or ESRD and need out of area dialysis, Medicare SNPs typically have specialists in the diseases or conditions that affect their members.
Okay.
All right, and then also all SNPs must provide Medicare prescription drug coverage. So with those plans, you don't have to worry about whether or not they're going to have a separate drug plan. These plans automatically come with prescription drug coverage, so you don't ever have to worry about that. So they make sure they try to take care of their members who have disabilities.
Okay.
And also, in most cases, SNPs may require you to have a primary care doctor, or the plan may require you to have a care coordinator to help with your health care. In most
Mm-hmm.
cases, you have to get a referral to see a specialist in SNPs. Certain services don't require a referral, like these: yearly screening mammograms, an in-network PAP test, and pelvic exam covered at least every other year.
Okay.
Right, and plans should coordinate the services and providers you need to help you stay healthy and follow doctors or other healthcare providers' orders. If you have Medicare and Medicaid, your plan should make sure that all of the plan doctors or other healthcare providers you use accept Medicaid. And if you live in an institution, make sure that plan providers serve people where you live.
Mm-hmm.
And then here goes a little over Medicare penalties. When you do not sign up for Part A, B, or D, when you are first eligible or first become eligible, you can incur a late enrollment penalty, as we stated earlier. And we heard your complaint about the lifetime penalty that they put on you.
Yeah, I am looking at with that.
Yeah, yeah, that's not
Okay.
good at all. These are just some of the companies that we are contracted to sell insurance with for the 2020-21 AEP season. In Tennessee, we got Humana, Cigna, Bright Health, and WellCare, as well as Aetna and United Healthcare, and then Arkansas Blue Cross Blue Shield. And then you can also find all of this information right here on Medicare.gov, because that's where we got our information from.
Okay.
You have any questions, Sister K?
You know who I can call about this late enrollment situation? That's all. And I'm just playing. Go ahead.
Social,
I'm just
Social Security is that's the
okay.
only information we can tell you. Social Security.
Okay. Well, I think I'm gonna try talking to these one of these. You said senator, whatever,
Yeah, who was that?
congressman or somebody,
Yeah,
because
for
this is
Tennessee.
this is sensitive.
Hmm.
Huh?
Well, who is that? Marsha Blackburn.
Oh no. Oh, that's that Republican.
Yeah.
She's one of Trump's friends. No,
Yes, ma'am.
no, she is one of Trump's friends. I don't want to talk to her. Uh-uh.
I understand. Well, Minister K, we appreciate you so much. We're going to put our contact information back up on Facebook because we're providing free quotes
Okay.
next week. In the weeks following after to the end ADP, we're going to.
I can't hardly hear you, Erica.
So during this season, for the rest to
Mm-hmm.
December the 7th, we're
7th.
going to
Uh-huh.
be giving out marketing because this was an educational um, invite here. Now we're going to
Okay.
be marketing for the 7 companies that we stated for, and those are going to be in the future. If you know anybody who's 65 and older who really needs to sit down and just go through their old plan or previous plan, just let us know or send them our information. Okay.
Okay. Cause I mean,
Amen.
do I have? I don't have to do anything. Do it with me being already in Cigna.
No, ma'am, you're good. You can stay where you at if you like it, but this is what I will always encourage you to do.
Okay.
um, Go over your summary of benefits and see what's going to be out there for next year. If you can,
Okay.
that's how you compare what you have now from what's in the future. So it's always good to look and see what other people are offering, but
Okay.
don't ever give them out your Medicare number and
Okay.
never give that out, never give out your financial information. You would never pay an agent. Of course, you know that all that money goes to Medicare. We should never, an agent should never ask for your money. And so yeah, that's the biggest thing there.
Okay. Okay. All righty. Well, I'm gonna do that. I'm gonna try to get that letter. I'm gonna look around here. I may have it, and I just didn't open it.
Okay. Well, we thank you
Hmm.
so much, and we appreciate you. You have a wonderful night. Okay.
All right, y'all too.
You
Thank you,
Take
thank
care of
you.
those
Minister K.
babies.
Yes,
We
Okay.
ma'am.
will.
Uh huh. Love you. Bye
Love you.
All
bye.
right.
Bye.
Love you too. Bye bye.